I'm going to call the Clay County Board of Commissioners meeting for April 23rd, 2024 to order. First item on the agenda is approval of the agenda.
Move to approve with the additions.
Okay, we have motion. Do we have second?
I'll second the motion, Mr. Chair.
Okay, all in favor, say aye.
Aye.
Opposed, same sign. All right. Next is approval of payment of bills and vouchers.
Citizens, do the citizens.
Oh, I'm sorry. Keep missing that. Thanks. Any citizens here to be heard who want to address any item that's not on the agenda? Steve, do we have anybody online?
You do not, Mr. Chair.
Okay. Next is approval of payment of bills and vouchers.
Move to approve.
Second.
Have a motion and a second. Any further discussion? If not, all in favor, say aye.
Aye.
Opposed, same sign. Next on the agenda, Senator Robert Kupec. Rob?
Approval of the minutes. Do the approval.
Oh, I'm sorry. My mistake. Boy, I am just waiting. I got to get more coffee. Next is approval of minutes from April 9th, 2024.
I'll offer a motion to approve the minutes from April 9th as presented.
And we also have the minutes from March 26th from the work group session.
Right, I was going to do it in a separate motion, but I can do it all in one.
Okay?
Second.
Have a motion and a second. All in favor, say aye.
Aye.
Opposed, same sign. Now, Senator Kupec, good to have you with us. We appreciate you coming.
Glad to be here. I don't know if we're using the formal mother and father address of Robert, who are the only people who call me that, but sure. Sure. And it's not usually when I'm in trouble. That's still how they address me. So that's well, very happy to be here. I thought I would maybe just go over, maybe just highlight a couple of things that might be of interest to you, of some bills that I'm carrying and things moving through the legislature. And then mostly I would, just like to hear from you, your questions, things that you have that are on your radar that maybe I should know about, or give you some updates on those. So one of the things last week in the Health and Human Services bill, we had one of the bills that I authored was for child care facility grants. This was a program that we had last year. They're available to child centers, in-home child care, and the grants previously had averaged about $9,000. So these are pretty small level grants, but they opened up hundreds of actually spots of childcare across the state of Minnesota. And these are just things for facility updates, whether that to be kitchens, maybe even a home place that needs to build a fence around their yard. But just by doing those small grants, they were able to open up a lot of spots. But the program successful enough that it ran out of money. And so even though this is not a budget year, we allocated just a small amount to keep that program going until the next budget year. But it's certainly, particularly in rural areas, it's been a real plus on that. One other bill that I am the chief author of is the elimination of the shotgun only zone for deer hunting in the state, which in Clay County is a very bizarre line that runs down Highway 32 in the eastern part of the county down, then cuts over to Barnesville and then picks up I-94. So basically, if you live in Hitterdall, on one side of the road, you could use a rifle, and on the other side of the road, you could only use a shotgun. It dates back to the 1940s, had to do with a concern when we didn't have enough deer, and they were apparently afraid too many people were going to get deer in southern Minnesota. But we are one of the last states that has this. Wisconsin did this about 10 years ago, and everything, deer population, safety, no concerns over there. So it's something I worked on last year as a co-author, and this year they asked me to chief author it. So that's one of the other things. And then I had a bill for money for computer upgrades for counties for Health and Human Services. That the state last year, we gave a lot of money to update their Health and Human Services computers at the state level. Some of them were using programs that dated back to the early 90s. And they were really outdated. So that was good, but the problem was that a lot of counties, their systems are older too, and now they're not going to play well with the new systems, so there is a need there. That, because it is not a budget year, also did not get money in the Health and Human Services, so we are going back and looking at maybe another course, but certainly if that does not get through this year, that is something that will be a high priority next year to make sure that our counties are able to get that information and go back and forth between the state level. I suppose the other big thing you would probably want to know about are bonding issues. And as usual with most sessions, bonding will still come down to the end. So there's been discussions of bonding. So again, if you have questions on that, I can fill you in. But as of right now, there have not even been any hearings on the capital improvement committee, but those will be coming soon, and then we'll get some kind of deal hopefully at the end to get some bonding done this year too as well. So with that, I'd be happy to answer any questions you may have.
Frank?
You talked about the deer season. I've got a constituent there that's talking about wolves, trying to control wolves a little bit. I know they had some meeting or whatever going on as far as wolves. Were you involved in that at all? Do you know what's going on with that or where we're at?
Sure. Well, we had there was a bill, the omnibus environmental policy bill was up on the floor of the Senate, and so there were a couple of people that tried to amend the bill specifically to deal with wolves. So the way it is right now, the federal government says no wolf hunting in Minnesota, and there was somebody tried to amend the bill to say no, open up to wolf hunting. And then somebody else tried to amend the bill to go the complete opposite, to say never have any wolf hunting. So the way we left it is we're going to stay where we are right now, and if the federal government lifts that ban, the DNR will make the determination on whether there is a wolf season. I can tell you on the agricultural side, we do have a fund for wolf depredation. So if they interact with livestock, we do have ways to either help keep wolves away or give you some money if you lost something. I will say my predecessor, Senator Eakin, was a big proponent of donkeys for everybody because donkeys weirdly keep wolves away. And as a Democrat, everybody having a donkey was probably not, also kind of goes,
Nice plug.
fits the messaging there.
Easier if that helps them out.
Easier to get than elephants.
Elephants probably would also work very well at keeping wolves away, but not with our climate.
Any other questions?
Mr. Chair, I might follow up with that. It was not part of my question, but I am hearing that, one, appreciation for the Wolf Depredation Fund, but that really how problematic and time consuming it is to go through that when you have a catastrophic loss and when you talk the hours that it takes to prepare that, it really, the cost per payment goes down significantly for producers. So I know it's a major issue. I know particularly around here, we're starting to see fewer and fewer coyotes, particularly because that wolf herd has come down so far. So and continued work on that is appreciated. But if I might follow up with mine, I just want to thank you. You've been really open and available for us when we've had questions and concerns, particularly with the files that you've authored and co-authored for us. So thank you for that. Particularly with the PRTF component, we've worked a lot with you on that. And now as we've shifted a little bit, we're expecting a House file for the Juvenile Detention Center, and you were part of that. So certainly would appreciate you authoring that on the Senate side of things. But we'd reached out to you as a board in regards to broadband and prevailing wages, and as you are aware, we were able to secure a grant in Clay County and going after, we're not, but Red River Communications is for Southern Clay County, and that would really, if that were to go through, just be such a equity for accessibility issue in Clay County. For us to be so close to such a fast growing metro in the area, and for the cost per setup to be $33,000 for one home setup, and you start talking about these really isolated areas of the state. If that were to go through, it would really cut down on the accessibility. So certainly would appreciate you relaying that point of view there. But thanks for your work this session.
Sure. And I will say on the prevailing wage side, particularly on the broadband, I think there is, particularly in greater Minnesota, a realization too by people who are in the unions that sometimes that can inhibit projects going forward. And in the end, they would rather see a project go forward because that's a job, and they would prefer to have the jobs on that. So there is still ongoing discussion about that around the broadband issue. So
And I would say in regards to prevailing wage, I think the argument is that it's such a higher quality work. If you offer prevailing wage, I would argue, I'm not sure if that's the case. And I think there's some pretty substantial projects going on in the area that have or haven't, and it would be interesting to talk to the supervisors on those projects for that.
Yes, Paul.
Senator Kupec, maybe to piggyback on what Commissioner Mojo just said, I too want to thank you very, very much for the timeliness of our meetings that we've had, and I'm sure we'll continue to have in regard to the PRTF and now along with the transitional care. I have to weigh in just because my sister and brother-in-law have a big bison operation in Clay County, or Otter Tail, excuse me. And, the part on the wolves, once again, I think we talk about when animals are taken, there's, considered monetary amounts to replace them, but it doesn't replace the bloodlines that are lost, and those take years to develop. So I just hope, I think our two senators are somewhat in line with having DNR manage, are they not? Do you know, on the federal side? Klobuchar and Smith?
sure, yeah, I believe, yeah, on the federal side, that is the case. So,
Okay.
that's, I think, it will depend. Hopefully, the DNR will bring science to this and see which areas, that it is an issue. But it is, if I believe you have the ability still, if there is a wolf that is attacking, that you
Yeah.
have the ability to go out and, use a firearm to dispose of that wolf. So whether we, should go to opening the hunting season, I think, in some parts of the state, will be up to the DNR to make that decision.
Yeah. And thank you just for everything.
Any other questions? I'm gonna be the last guy to sing the same song, but we really appreciate your accessibility and your collaboration with this board, and we look forward to working with you.
Thanks.
And good luck for the rest of the session.
Sure. Thank you very much. I appreciate all your input and keeping me, informed too of what, your perspective is and what the county needs are, and always happy to work with you. So thank you.
Safe travels.
Thank you.
Next up, we've got Joe Olson, our facility. Okay, we have Joe Olson, our facilities director. Joe, you've got a lineup this morning with us.
You bet.
I'll let you get situated and get comfortable, and we'll call the first one. First item will be Family Healthcare Remodel Project update.
A few handouts here quick from them.
You were just gonna let me talk. Timing is everything, isn't it?
Thank you.
Oh, don't be.
Okay, I will, All right, good morning, Mr. Chair and board members. We are here today. I got a pretty important crew with me. As you guys remember, we entered into kind of a deal with the Family Healthcare to remodel Suite 106. And it's been quite a little journey. What I can say is it's been a pleasure working with them. Whatever they said they were going to do, they did. And anytime we had any kind of issues, we got a hold of them and they took care of it quickly, and it was a good project. So I'm going to turn it over to this crew for introductions, and they're going to talk a little bit.
First of all, good morning. I'm Kalen Frappier. I'm the former Chief Operating Officer at Family Healthcare. I retired a while ago, and this was kind of my swan song, be able to see this through fruition. I remember sitting in front of most of you previously with regard to this big project that we were undertaking and looking for your approval to move forward with that space. Joe's done a tremendous job in trying to lay the groundwork with you all and kind of help us get this off the ground. It's been an interesting year, quite frankly. As big as this project has been, I guess I would say maybe not being in the nuts and the bolts of everything, it's really gone smoothly. And I couldn't imagine a project this large actually coming across or finalizing as well as it has. You have a handout in front of you. First of all, let me introduce my colleagues here. If I could start on the right, maybe you could introduce yourselves.
Good morning, I am Margaret Asham. I am the interim CEO and the acting CFO for Family Healthcare, so thank you for having us.
I'm CJ Sarr, Facility Manager for Family Healthcare. Thank you.
And then I'm Matthew Eaton. I'm the Dental Director at Family Healthcare.
I wanted to have them all here. This is kind of our thank you meeting, so I appreciate you allowing us to be on your agenda and try to keep this brief. Hopefully we don't have any major issues that we need your attention on. It was more along the lines we wanted to show our appreciation, as well as maybe highlight, if you all have an opportunity to come and join us. We do have an open house scheduled over at Family Service Center for the dental clinic, starting at 4 o'clock, I believe, tomorrow. We would love to have you. We are extremely proud of our space. Underlying all of this is our belief that the people that we serve deserve, I guess, a place that reflects the quality of care that we provide to them. Typically, we speak to our clients and our patients as being underserved. It's much broader than that, but we felt when we had the opportunity to be able to provide a space that was top of the line, our providers were very excited about being a part of it, as well as our patients feeling very comfortable and proud of going to a place that reflects the quality of our providers and the staff that we have. So I just wanted to extend that invitation to you. On the handout in front of you, just skip ahead to page 3 if you would. My talking points are they not? Oh, okay. I had a couple different graphics that depicted the space that we previously occupied. We had approximately 2,100 square feet that we occupied on the first floor of the Family Service Center. And through a lot of moving of other clients in your facility, an adjacent space of about 3,000 square feet came available. And that was a perfect opportunity for us to be able to leverage what we had for an existing clinic, as well as expanding in that same space. So we had a 2-phase project. The first phase was to build out the additional 3,000 square feet while we could keep our clinic open and available to a current client base. And we were able to do that. Phase 2 of it then was obviously to remodel the current space that we had. So I'm just going to touch on a few of the details here, and then at that point, I'm going to turn it over to Dr. Eaton, who can share with you really the clinical aspects of the remodel and what our objectives were. As Joe had mentioned, this was going on approximately a year now. We have finalized all of the remodel work. We are open for business. The lease that you will be presented or have been presented is a brand-new lease that your attorneys as well as our attorney worked together on. A couple of big points to bring on with regard to this new lease. The rate, we did adjust the rate back up to where it is commensurate with all of the other leaseholders in your space. So we brought that up to par. And then we also entered into what we believe is an appropriate term for the capital investment that we've made into this space. We were requesting a base term of 10-year lease and as well as 2 5-year options. That allows us to basically depreciate the $2.5 million that we've put into this facility. And I think Clay County's been an exceptional partner to us over all of these decades. And I think that's a demonstration of our commitment to Clay County, and hopefully it's reciprocal. As I mentioned, the scope of the project, we are at about 5,000 square feet now, which is a tremendous amount of space for us. We've expanded the current facility from 7 operatories to 14 operatories, which is in itself a very large deal, and that allows us, as which Dr. Eaton will talk about, the number of patients that we're able to see substantially doubles. Probably the other big thing with this space is we were able to develop it and design it from the ground up, and I'll give credit to Dr. Eaton and his folks. From a clinical design standpoint, it creates efficiencies that you know, if you have a blank slate, you build them in, and I think he did a tremendous job in being able to create a facility that really does creates a highly efficient operation. If those of you back in the day when Sanford Hospital built their new hospital, they have a concept called on-stage, off-stage, and basically there's public areas and then there's private areas. And this is essentially what Dr. Eaton has created as well, is where all of our patients are in a space that is public, but all of the other work, the financial and so forth, are done behind, off-stage, if you will. We had a really, was a exciting for us because it also then accommodated what Dr. Eaton is, I'll call it his legacy at some point, but the creation of a dental training facility. And our hopes are that we will be able to recruit either last year dental students or dental providers, dental hygienists, assistants, and be able to train them in their final kind of rotations, if you will, and having this as a pipeline for us to be able to bring providers and dental support people in to become part of their, you know, our future, and then bring them in and serving the patients that we serve. So we have training facilities, we have a wonderful design. If nothing, I don't want to disparage the old space, but it was dark and it was close, and if you had like 4 or 5 patients in there, you were literally rubbing elbows with those patients. This new space is open, it's airy, it's modern design. It took advantage a lot of the architectural design and the features of the facility itself. So you'll see, if you had an opportunity to be there, you'll see some of the open architecture, you'll see some of the open concrete rafters and things like that, which really makes for a very unique design, but it's a really highly polished, it looks like a wonderful place to come and seek care. As I mentioned, you know, the investment for us has been approximately $2.2 million, which for family health care is a big bite of the apple, but we've had some financial support from some major donors that have helped us do this, and then also it's Margaret and her people in the finance area making this happen with reserves that we've been able to develop. I just wanted to mention a couple key contributors to this project. Some of them are located in the Moorhead area, some are in the Fargo area, but Michael J. Burns, architects. We had 2 architects work with us, Carrie Puser and Luke Gulbranson worked with us from day one. Fantastic organization. They have worked in historic buildings. They have kind of a history of being able to do creative things and certainly a knowledge of working in a clinical environment. So some of the things that they did as part of this were fantastic. Henry Schein is a big dental provider across the country. They were also instrumental in this, and then Meridian Commercial Construction was our general contractor who we worked through. And there's a list of other vendors that we also worked with. I want to give credit then to Delta Dental Foundation of Minnesota, Warren B. and Geneva L. Anderson Family Foundation, as well as the Otto Bremer Trust, were integral in providing funding for that. And some of the names, obviously, of the folks that were principals in this organization, both vendors as well as from our organization that helped bring this to fruition. So that's my little bit of oversight. I'd like to turn it over to Dr. Eaton to kind of tell what we're intending to do with the clinical space. Thank you.
The less of a polished speaker here, but you know, I've been the dental director at Family Healthcare for about 10 years now, and so, you know, I think trying to touch on is there's tremendous dental need and a dental access problem in our community. And so it's really fit well for us to be in the Clay County building. There's many similar services that are provided in that building. And so it's been, towards Caitlin's point, a really reciprocal relationship where I think that we, fit well in that building. And so, trying to take a look at, the dental access problem that's in our community, it's really been 10 years for us through this process where we've, added additional space, added additional providers. Got to give a lot of credit, to the dentists that we're willing to create, be part of our team where we've got, 4 dentists now that have been working in public health for, over 10 years. And it got us to the point when we took a look at this project to say, how do we continue to help this access problem? And so, and at some point it does become about workforce, and so we took a look at, leveraging the skills that our dentists have, and we've created an affiliate program with the University of Minnesota. And so thinking about that and, in essentially trying to create a pipeline, I'll say, of students that can, one, have it, their 3rd and 4th year dental, actually they're just 4th year dental students that come and are supervised by our dentists to help treat patients and, and make sure that they're, receiving the same quality of care and that they're well cared for, but we're also giving them an experience to public health. And then we really do believe, and I think that, it's part of the reason why we've had providers, stay as long as we've had, that we have tremendous culture. And so hopefully with that exposure, and there are some different, I can touch on loan repayment possibilities, some advantages of working in community clinics as well, that some of those dentists, as they're coming through, will see that, there is a career that can be made there, and it really goes to help, our patients and our community. And so with that in mind, we did design a facility where, one, we've got room for, our current dentists and hygienists, but a specific wing of the facility so that we can engage in with these dental students. And so to the point of the project, I would say it's already been a success because those dental students actually started in April already, and they've been going through their, they're probably 3-4 weeks into their first rotation. Things have been going well, and so we, hope to see that continued strategy continues to play out. But it's pretty amazing what that facility has transformed into. People did used to call it the dungeon a little bit, right? The space that we had didn't have any windows. Everything was an 8-foot, ceiling. And by being able to add this additional space, there's an access to the outside. We've moved all the ceilings to 12 feet, and so it does 2 things. One, gives patients, the sense of, that they're coming to a state-of-the-art facility and that they're going to, receive great care. And I think it also does something additionally for our staff. There's, when you're going to work at a place that looks beautiful, I think it enhances our culture. And so, taking a look at what some of the, the main goal of the project, it's still helping people, right? So, we hope that it should, just as we feel that, it'll allow us to see an extra 9,000, visits a year. But that's really just the stem of what the capacity is at that clinic. The hope is because of adding this training program, it will allow us to assess what the needs are in the future and, potentially, creates a stemming point for us to, to create other clinics if we need to, if we can, continue to develop that workforce and ensure that, and if there's still need present there. And so, yeah, I guess I just wanted to thank Clay County because they've been a tremendous partner, and we're excited to be in the building, and I just feel like it's been a really good fit for all these years. So, and thank you, all of you.
Yeah, Mr. Chair, I just want to mention too is a great benefit to them remodeling the spaces. It's, as we know, it's an aged building, and we're looking at how to invest in this building down the line. So they've really given us some great ideas to kind of continue on with, when we decide to start upgrading some of the other areas as well. So I thank you for that. So.
Well, thank you, folks. Any questions? Kevin?
Not so much questions, but a couple of comments. Being on the building committee, we had, with Commissioner Gross and I, we had ample time and to watch this plan as it progressed, and we were really pleased with what we were hearing. And it kind of culminated for us when we got to have a tour of the finished project over there. And it is really something. You really did a good job. And your idea moving forward with the ability to have people coming in and as part of their training process is just an incredibly good idea. When it comes to the building itself, we're doing some long-range planning on that right now. And one of the interesting components of it, about 40% of that building now is basically for entities outside of Clay County. And the other 60%, it's our internal departments. As our demands grow for county, we might have to be looking at adjusting that. Fortunately, with your investment and what you've done, I think you're a lock in being able to stay.
We appreciate that. Thank you.
Yeah, and again, that's my opinion, but I would certainly say that with confidence that with your investment. And the fact of the matter is what you do in the dental area and the public still needs that, and it is another portion of public health, of which that is another major tenant and internal program that we have in that building. So I see this long-term partnership as a really good thing, and I wanted to thank you for your investment into that building. And as Joe said, with what you've been able to do there, as we look at ways to alter as we move forward that building, the last thing I ever want to see is that building tore down. I think that should be set for many, many years to come with some modifications to it. But again, I want to thank you for your investment and your insight and your vision, I guess, for what you're looking at for the future of that, of what you do.
Paul?
Just a curious question. With the expansion, what's your forecast on number of patients, that type of thing? And also, where do you draw from?
Yeah, so, we would anticipate that we should be able to add, just with that expansion, another 9,000 patients or visits when it's fully staffed, right? So there are, unfortunately, like right as we went into it, right, we had a dentist leave, but, we've replaced some of that with some of the students that come on. And so as that workforce, as we fill the rest of that building, we're able to, further open up the, our patient load. I'm sorry, you had a second part to that
Just
question.
where do you draw from?
Yeah, so, I should look at a geographical map. I might have to turn to say, our main portion is from, Clay County, but we do touch a couple of the other counties where people are driving a long ways for dental care, at points. I don't know if anyone else could answer that.
I would say we definitely draw from the Moorhead area, Dilworth, kind of just the surrounding metro area. We also have dental offices downtown in Fargo as well, with a few dentists, but so we draw from that area. But definitely.
I had no idea that number would be that big, so.
And Paul, something that I don't think the numbers have changed a whole lot, but at the time when we, I think, originally presented to you with regard to the potential, we had a waiting list of 2,500 to 3,000 new patients that had nowhere else to go. And that was also kind of the impetus by trying to find additional capacity. So in addition, like to the 9,000, we're trying to find a home just for a lot of people that just are not getting care today.
Well, thank you for everything.
Any other questions, comments? You provide a service particularly in need to a lot of people that wouldn't have another resource if it weren't for your presence. You're great partners. it's really gratifying. This is another Joe moment. I've never had anybody come in here and say, well, you guys could have been a little more supportive or helpful, because Joe's got it pinned down on every project we've given him. So this is just a great combination of good services that are desperately needed, and us as a county being able to have the resources and the staff to support your investment in this. And we're not going anywhere with you guys. You're a lock. And Jill, if you want to, we can move right on to
Yep.
the contract portion of
Yep,
this.
we could do that. That'll work.
Yeah.
So, yes, as Kalen had mentioned before, that we want to make it clear that both legal team, Clay County office, we worked with Mike Leaser, and we worked with their legal team, and we worked out a new lease, really worked out a whole new-looking lease versus what you guys are used to seeing. But it basically, the points are, it's a 10-year lease. You got a couple increases built in within there, and that's really it. It was, prior to this lease, it was formerly known as 106A and 106B, and so we had two contracts out there. We now have merged that lease into one contract, and it's just called Suite 106. Keep it simple. So I'm here today to ask approval of this lease.
Any questions, or I'll entertain a motion?
Mr. Chair, if I could just make note, in section 1.5, renewal options, and I'd confer with County Attorney Melton, is that generally we have a lease proposal when it comes to the extensions where there's an agreement of both parties. I would just highlight in this area that the 5-year terms, so the 10 years would be up to the dental clinic based on how this contract is written.
Very good. Thank you for pointing that out. Frank, did you have something?
No, I'm just gonna make a motion to approve the contract.
Okay, go ahead.
I did that.
Have a motion and a second. Any further discussion? All in favor of the motion, say aye.
Aye.
Opposed, same sign. We're a go. Thank you, folks.
all.
for-
We appreciate everything. We appreciate the partnership. It's been fantastic for us.
Same from this side. Thank you.
Mr. Chair, Commissioners, you'll note on your upcoming appointments or upcoming meetings that there are open houses there, so the full board could participate if they wish.
Yep, a couple of us, and you are going to be out of town tomorrow to the state capitol, but the others, at some point, I'd love to see it. Okay, next up is Kathy McKay, our Public Health Administrator, along with Joe. Request to approve for Public Health to occupy 307 and 310 at the Family Service Center.
Yeah, so I'll start off here, and if you have questions, I have Kathy here with me. We, on the third floor of the Family Service Center, we have two small offices that make up 435 square feet. They're kind of close to each other in the same hall. A tenant, Northwest, I believe they're a state and nonprofit, or a state entity, I think, I'm not 100%, yeah. They've had some staffing changes and stuff, and they are going to be moving out and gave us the notice. At the same time, we've been talking about getting Kathy a little bit more relief with some of her staff that she's bringing on board. So at this point, we were asking if Public Health can acquire those two small offices starting May 1st, and we have brought this through the building committee for approval, and they have signed off. And anything more for you to add, Kathy?
Yeah, our second floor is bursting at the seams. We now have 3 people in an office space that really shouldn't be accommodating 3 people. So we have 2 offices with 3 people in those, so we're really way over our capacity on second floor. So this will alleviate a little bit of that.
Any questions? If not, I'll entertain a motion.
I'll make a motion to approve Public Health to occupy Office 307 and 310.
Second.
Have a motion and a second. Further discussion? If not, all in favor say aye. Aye. Opposed, same sign. Thank you.
Thank you. And can I just comment, the county administrator offered a spot for me over at the government center, so I'd move and give some. Did you?
I'm going to put her right next to me. Try to keep an eye on her.
Careful what you wish for.
I don't want either of you to be lonely.
That was a nightmare for Steve. He doesn't want me over there.
Okay, I'm going to break from the agenda for just a second. Commissioner Mojo has got a 3-hour drive to her next engagement, and in order to keep some state trooper from getting into pursuit, I'm going to let her do her committee reports right now before we move on further.
My insurance adjuster and my husband, thank you. That. Last week, I attended the Clay County Planning Commission meeting. We did have several hearings on the evening. There was two petitions that were moved to the May 21st meeting, but we did have a update conversation on the land development code. We had a request for an interim use permit for a mining permit in Scree Township, and that was approved, and a petition for rezoning that will come to this board in Oakport. It's in the Tier 1 expansion district, hoping to move it to the Tier 2. And it was forwarded to this board for approval. We did have a petition for rezoning in Holly Township from an aggregate to highway commercial. That was also recommended for approval to this board. And then also a request for a platted subdivision that will be coming recommended to this board. So lots of continued conversations. I believe if you have any questions on the ones that will be coming towards this, I can work with you or Matt Jacobson to have conversations, but that will be included in a packet, I believe, in the next 3 weeks. We're hoping to get that on. Did have a couple meetings with Representative Keeler in regards to making sure that we have everything square away for the testimony tomorrow on the we don't have a bill number yet, but in front of the Capital Investment Committee. And then a huge thank you to staff, both Steve and James. Commissioner Ebinger and I have been working with them. They've really been doing the heavy lifting. We're just there to nod and smile. But tomorrow we will have the opportunity to testify before that committee in regards to the juvenile detention space. I've been working, Senator Johnson has availed himself to meet with us as well, and we'll also meet with Representative Joy. We'll work on that. I'll get those times to you as that day flows. And then we also had I apologize for missing the small cities meeting, but we did have a very important meeting at MetroCog. You know, we've talked a lot about those planning dollars, that MetroCog did get back from North Dakota DOT. There seems to be a little bit of a hiccup in making sure that entities are coming forward with projects. I certainly encourage staff to work with all of the entities and particularly our county engineer to make sure that if there's any planning dollars or planning projects on the horizon, we'll push those forward, maybe rush them if we need to make sure that we're spending all the dollars allocated. There was some conversations, you know, the Dilworth project, working with the railroad, as I've said several times, is really challenging. So Dilworth continues to push forward on that. There is a 15th Avenue study between Clay County and Dilworth that we'll be looking at. I did encourage them to maybe go a step further. They haven't done a traffic count on that road since about 2020. And as we've added additional infrastructure components, it might be important to maybe add that as an element to utilize some funds there. But I believe that, unless you want to ask me how kindergarten registration and college registration went, I think concludes my reports.
A glimmer of hope and a long challenge ahead of you.
Yeah. Your best guess on which one.
We've all gone through it.
Yeah.
Thank you.
It's fun on the other end. Being an empty nester is not bad. Thank you. Okay, we're going to move on to our next agenda item, which is going to be a request for approval to draft a cannabis ordinance. We've got Kathy McKay with her crew. We'll do the introductions as they speak, and looking forward to hearing this. This has been a big topic here for the last year or so.
Thank you, Mr. Chair and Commissioners. Jason McCoy is part of our health promotion team, and Rory Beal is here as well as the health promotion director, and I'll let Jason talk through the process and information.
Thank you all for having me back. And this is just a follow-up. We started this process meeting with Commissioner Ebinger and Commissioner Krabanoff, kind of got the direction that, yeah, we do need to really research on what this new legalization of cannabis meant for us locally. And so I spent a lot of time doing a lot of research, watching a lot of webinars, discussing things with the Office of Cannabis Management, Minnesota Department of Health, as well as other states who have passed legalization in the past. I brought a presentation to you guys about what was going on, and then with that, you directed me to go out and talk to the cities, and specifically their city councils, about what they wanted us to do. So that's the results of what I'm bringing back. I kind of tried to put it all together here for you on 3 slides. In a nutshell, what I can tell you is at this point in time, Moorhead has passed a zoning ordinance, which is an important piece of any ordinance that we have, because that will decide where any of the businesses are allowed to locate. There are roughly 16 different kinds of cannabis businesses that are listed in the state legislation. So it's important to understand the difference between if they're just selling, or if they're growing, or if they're developing the product, or all of the above, right? So Moorhead has indicated to me they do want to stay on their own for doing their ordinance. However, they are very interested in what we will do as far as registration is concerned. Dilworth is kind of 50-50. They didn't take a vote as to whether or not they wanted to join up with a county ordinance or not. They have passed an edibles ordinance specifically because that was, if you remember, was passed about a year ago. And edibles, we're talking about the low potency hemp products that are in like beverages or sometimes in a gummy or something like that. Besides that, Barnesville is the only other entity inside of Clay County that has passed an ordinance at this time, and their ordinance was around use. They wanted to control where cannabis smoking or vaping was going to be allowed to happen. And that was a model ordinance. I believe all of you have seen that. At this point in time, it was created by the League of Minnesota Cities. I think that's actually where we started the conversation a few months back. Besides that, the other entities that I talked to are all very interested in working with us. I did not promise any of them that, or I did tell them that we would not pass an ordinance about them without talking to them again when we have a draft put together, but they were all very interested in working with us. The chief pieces that they were very interested in, everyone was interested in the caveat in the state statute where we could limit businesses, these are the high potency businesses, to 1 per 12,500. There was a great deal of interest in cannabis businesses being 1,000 feet away from schools and 500 feet from daycares. And then also that public use piece. There's a lot of concern. We're having just an amazing spring already, right? And so people are outdoors already. And there's a lot of concern about the fact that without passing a local ordinance around use, a person could be in the park right next to some kids or things like that, you know, so limiting where that would be. One extra piece I would put in there was that I talked with, or I went to a webinar and then also their first planning committee for the Office of Cannabis Management, and they put forward their legislative priorities. Their number 1 priority is to begin accepting applications in July instead of waiting for the sale date of January 1st. And so that lends a little bit of impetus. I pursued that and got a little more feedback. Sales would not start this summer, but they were looking to get licensing applications in earlier from a business perspective, this is a helpful thing for us to think about, because if a person wanted to open a business in Clay County, they would want to know where to lease property, and especially if they wanted to grow, they would need to know where they could do that, so that they didn't rent a storefront, for example, that we were then going to pass an ordinance that said, you know, you can't actually open a business there. So it gives us a little bit of an impetus to want to have this going forward. So I'll pause there before I go forward. Any quick questions on that part?
Kevin?
I have just one.
Yes.
I'm just curious as to why there was a difference in the thought regarding 1,000 feet from schools and 500 feet from daycares. I'm just.
That is the state statute limitations. They allow us to do that. Interestingly enough, it doesn't allow us to put a distance from others, like say a church or a youth center or something like that. It only allowed us to do 500 feet from daycares and 1,000 feet from schools.
We should
That's
have
all we're
Kupec
allowed
stay
to.
for this.
Are those the minimums or maximums?
Maximums, yes.
Okay.
And we cannot go beyond that. If we wanted to say 500 feet from a church, we do not have the authority to write that into ordinance.
Correct.
And if we wanted to go 1,000 feet for daycares, we couldn't?
Correct. Yes.
I really don't think the footage makes much difference, you know, if you're gonna drive up to a cannabis place, you gotta drive 500 feet more or 1,000. I really don't know what that part of the distance from schools or stuff like that has to do.
The reasoning is in a lot of states, for example, I can use, I presented to for social services, I presented to the daycare providers and the foster families. One of the gentlemen actually grew up and lived in Washington before moving here, and he talked about the fact that that amount of distance can be around the corner. It's still close. 500 feet is close. I think we can all agree. But it could put it around a corner, and the further away, the better. Because when kids are walking to and from and going in and out of a facility like a daycare, for example, the closer that the proximity is, the more that advertising will be seen. Just like if you think about our gas stations right now, right? Every single gas station has advertisements for the lottery. They have cigarette, beer commercials, things like that. Things that science is proving that it's not good for the young mind to see these on a regular basis. And so that would be the reason why that was.
Well, if you can make it 5 or 10 miles, be okay with me, so.
That would be awesome. That would be awesome. I mean, did you have a question too?
Mr. Chair, so I've been a little uncertain about this 12,500.
Yes.
So if Moorhead goes in with 45,000 people,
Yes.
if I do modern math, that leaves about 2
Right.
for the rest of the county. Is that correct? As a minimum.
I did actually, that was, your math is correct. And I just got feedback. I was talking with the Public Health Law Center about some of this information I was going to be presenting today. And their understanding is that it takes the whole county. So let's use an example. If we passed an ordinance for the county of one per 12,500, understanding that it's written into our ordinance that we're not covering, we're not licensing or registering, I should say, Moorhead, we would still get to count that population.
Okay.
What that would mean is if those 6 stores opened up in Moorhead first, the whole rest of the county could decide whether they wanted to say yes or no.
I see. Okay.
So that was very interesting to
Yeah.
me. I thought it was exactly where you were going.
Yeah. Okay. Well, thank you for that clarity. So,
Absolutely,
Yeah.
absolutely.
If we have a situation where Moorhead has 6, let's say Dilworth has their own ordinance, and I'm not sure the population Dilworth, but it certainly would justify 1.
Right.
It couldn't do 2.
If they were part of our ordinance, correct. If they chose their own, then they can do what they wish to do.
Right up to the full population of the county.
Right.
So each ordinance can address this with the population of the county and the 1 per 12,500 population.
Absolutely. To be clear, though, also the opposite. So if Moorhead passes their own and they don't put a cap for themselves, they could have 12 stores. So
That doesn't interfere any other municipality or the county as a whole
Correct.
from counting the same numbers.
Correct. It would just give us the opportunity, if that was written into our ordinance, for everyone else to be able to say, not here, please.
Okay.
So with that in mind, page 2, our suggestions are exactly that we think about public use, specifically like our parks, our sidewalks, a definition of public spaces. Registration fees, the maximum we're allowed is $500 for an initial registration and $1,000 for renewals. I put in here that my recommendation is to do the maximum amount to start with, because there is no clear funding stream that will pay for compliance checks, that will pay for any of this work that needs to be done in our county. So we want to make sure that we don't end up paying our own tax dollars out for this when we could actually make sure that the licensing, well, I apologize, the registration fees are able to cover those. Zoning, we definitely need to think about where we want the businesses to be able to set up. Distances, as I mentioned, following with the cities, 1,000 feet from schools, 500 feet from daycare. And then also to think about waste, specifically things like clippings. A lot of these plants, when they're clipped, they just get thrown into a garbage bag and get thrown out on the dumpster. Kids are very smart. A lot of times in the past, kids would get their first nicotine from a cigarette butt off the sidewalk, right? So it would be, we could write into our ordinance that they need to be destroyed in-house. That way the youth can't get them, or others, it doesn't have to just be kids, don't get them and are able to make their own products, because then there would be no safety measures put into that. And also to think about the refining chemicals are toxic, and so we want to make sure that those are disposed of correctly. And that would be our suggestions for a local ordinance. With that in mind, I'm going to just roll to page 3 real quick for as far as our request, because that will help make things.
Mr. Chair, really quick.
Yeah, absolutely.
Sorry. Thank you for everything. I do apologize. I have to run to the cities, but I just want to say, and I appreciate that Matt's here. I really want there to be a strong level of collaboration in whatever we decide forward. It really needs to have heavy input from the planning department, particularly because, that's his wheelhouse, but I want to make sure that we're following and in close step with that. But thanks for your work on it.
Absolutely. And thank you for that, because that's literally written on page 3, is that we want that collaboration. We also want the county attorney's office to be part of it and law enforcement to be part of any drafts that we put together. So that is my request, our request for you. We just found out, we didn't have this opportunity until literally this week. The Public Health Law Center, who has helped us draft all of our tobacco ordinances and all the ones that I've worked on in 4 counties, has just been given some permission to put together a model ordinance that would help us. It would take a big load off of us in getting that written. And then with your direction, we would like to work with them to get this draft ordinance. At that point, timeline-wise, I would think we would meet with the county administrator, the county attorney, county sheriff, and the planning department. Also, for feedback, we would want to talk with the commissioners involved with substance prevention. I'm not sure if that's still Commissioner Kravinoff and Commissioner Ebinger, and get all of this cemented, and then bring that final ordinance to the full commission board for your approval to be able to move forward with that at that time. Timeline-wise, the Public Health Law Center told us that their model ordinance should be ready by June, so that would give us plenty of time to also take into effect what gets passed during this legislative cycle, so we don't pass something that we have to immediately amend as well. So that would be our request for you.
Just a question for clarification.
Yes.
As it stands now, and I know this is a moving target, as it stands now, am I correct in assessing we'll have no input on who gets a license?
We do.
We do.
We actually do. My understanding of the process, and this is, like you said, it is a moving target. They're still putting it on. My understanding is that a person that was looking to open a business here in Clay County would submit their license right now to the Minnesota Department of Health. This will switch over to Office of Cannabis Management. And once they get that license, they make sure that all the T's are crossed and I's are dotted. And then they contact us for the registration to say, and at that time, we get to give a feedback. Here's the moving target part of it. Who do they reach out to? I don't know if that email will land in our administrator's box. I don't know if that will be in law enforcement's box. I don't know. I do know that when I was talking with the city of Moorhead, that their zoning officer is who actually received that email. And that specifically is asking, is this store in a zone that you set up? Like, so are they applying according to your ordinance? And then we get the chance to also provide feedback. So if there's a reason that we feel this particular entity should not open, perhaps we know something that's been going on locally, we can submit that information, and ultimately the Office of Cannabis Management is supposed to take that into consideration. So that's my understanding how that would work.
In constructing this ordinance, we want to, as we do with alcohol, direct law enforcement for background investigation? Or is that not going to be supported by the state, or do we not know yet?
Great question. I will look into that and get that back to you.
Part of the issues, and I understand prior criminal convictions are going to be expunged. In fact, in some cases, I think that are going to get preferred for a license if they're identified as having been part of a group that's been unduly enforced against. But my question is, if you have an outfit open up and it doesn't have the proper financial backing to do the job correctly, they've got a problem with maybe past violations of alcohol licensing, things like that. Are these things that we can take into consideration? We do on issuing an alcohol permit, a license to serve alcohol. Are we going to have those same fallback positions? And if so, is that something we need to write into the ordinance?
I love that you asked that question. I will find out. My understanding is if it's anything outside of cannabis, the answer should be yes. But I don't want to say with all affirmation that I know for sure. Let me find out and get back to you on that.
Sure, and if we can just make sure whatever the answer is, if there's a necessity to include it in the construction of an ordinance, I think that's much easier now before we try any enforcement actions or we try to hold people accountable if they don't operate legitimately. We want to make sure that we have all the verbiage we need built into the ordinance. And I'm sure County Attorney Melton will also want to give it a good, strong look too.
Absolutely.
Yeah, Kathy.
Yeah, Mr. Chair and Commissioners, I just wanted to clarify one thing. When Jason talked about the early registration and early licensing, you're absolutely correct. It is for those that it's a social equity process and those that have been marginalized. So it's not for everyone. There's a certain number that they're going to accept for those early registrations and licensing. They still have to meet all the requirements, but that's the group that will be allowed to register early.
Okay, good.
Mr. Chair,
Commissioner
yeah,
Cravenell.
just one quick question. Going back to your second slide, so I have understanding. So let's go to zoning. You have industrial wrote there. And maybe I missed it, but is that what's being, why is it just showing industrial? Where'd that come from?
I should have put other zones as well in there too. I apologize. In the state statute, industrial was one of the zones that you could put in there.
Okay.
I probably should have either not put that or put other zones as well.
Yeah. Well, we'll have a lot of latitude working with planning and zoning.
Absolutely.
Okay.
Anything to say about that?
Good morning, Mr. Chair and Commissioners. So with regards to zoning, I think we would probably treat this as similar to other businesses that get permitted in the county. Anything related to zoning is going to have to go through our planning commission. It's going to have to be incorporated into the land development code as well. So in terms of, one of the things that Jason mentioned is there's 16 different kinds of businesses, and so how do we want to categorize or treat those locally? I think that's going to be a big part of this, and where that might be allowed. Is it an agricultural use? If you're growing indoors, that could be considered an industrial use. We allow for home occupations in Clay County. Are we going to allow cannabis to be a home occupation? I know Moorhead does not. They specifically say in their ordinance that cannabis cannot be any cannabis retailing, manufacturing cannot be a home occupation. So those are some of the things that we're going to have to consider with regards to zoning. And yeah, I think anything related to zoning absolutely will have to go through the Planning Commission.
Just jump in there and say that will not impact on those who wish to cultivate for their own or family use within the state laws as it reads now. But this would be strictly, we would control grow operation that's done for profit.
Yep, correct.
Yeah.
Yep, anything commercial or industrial. I do believe that I think it was an earlier reading of the City of Moorhead's ordinance. They did have the personal use in there, and they just had it permitted basically in every single zoning district.
Any other questions?
Mr. Chair, if I could, just first of all, I'd like to thank Jason for the work that he's done in that. We've had ongoing meetings or discussions about this now for 6 or 8 months, and I think the challenging part, as Jason has mentioned, is we don't even have the final legislation done, and so we're having to act with various options out there potentially. I think that one of the things that if you recall back when we met with the rural cities last fall, Jason provided us with the timeline, and I think the important part he mentioned, but I just want to be clear, the importance of really why there's some drive to this comes with the July 1st date, in the standpoint that if we don't limit the number of retail businesses in that time, it will essentially would become unlimited throughout the county. And so again, I appreciate Jason's willingness. I think that as we talked about when we first met with the rural cities, we kind of left that meeting as they wanted to be left alone. And I think through the education process, again, at the end of the day, they may choose to not join a potential resolution, or ordinance, but I think that they were very open as they were educated on that. And so I appreciate the work. Thank you.
Just if I can add something, in my experience on this type of issue, we had real disparities between Minnesota and North Dakota on paraphernalia, on synthetic cannabis that was being sold as incense and bath salts when I was chief of police. And I had a father whose child had been in trouble with the law over on the north side, or over on the west side, and he was an attorney, and his child had autism, and it had some real difficult times in high school, and he walked in and found synthetic cannabis and paraphernalia that would have constituted a felony violation in North Dakota. And that led to a pretty protracted effort on the part of the city of Moorhead to get a paraphernalia ordinance passed, which eventually it was. We are going to have substance that can be purchased legally here. In fact, we do now. If people get the THC beverages or the gummies that are criminal just by driving across a bridge. And it's going to be even more so when when these operations are licensed and go in full blown. All that is to say we need to regulate. There's going to be a lot of attempts by juveniles, both here and across over in North Dakota, to come in and purchase. We need to make sure we have responsible merchants I'm not going to make a judgment on cannabis use or on the state of Minnesota's decision to proceed with sale. But we just need to make sure it's regulated. We need to make sure that governmental entities that are licensing are also subsidized enough to cover the licensing process, the vetting process, and compliance checks. So as we move along on this, I know Commissioner Krabanoff and myself are both interested in participating in this. He's got a public health mandate, and I've got a public safety mandate, and I think we both have a lot on the table with this in supporting you and in your efforts to put this together. We got any questions or comments on this further? You guys have anything else we need to hear?
Do we need an actual directive or? Okay.
Yeah, I think at this point, it certainly wouldn't be a vote for or against an ordinance. It's the commission's direction to go forward and construct an ordinance. And I would entertain a motion for that.
I'll second with a question.
Sure.
Okay. So how, in this motion, are we gonna, should we be including zoning? They're an integral part here.
I think that and the sheriff,
Right.
that's all in the testimony that we've received today.
Okay.
And I think that's where they're
Well, yeah,
going
it has to be.
forward.
Yeah,
Yeah.
anything county related. Yeah, okay.
Anything additional?
Well, I think that timeline piece, in terms of needing to have that July 1st time period, I think is really critical, so that we have to have something that's brought to us, and I know that, Matt, that's gonna put pressure on the planning commission as well, but I mean, that doesn't mean that we might not be able to, talk about limits, prior to that, and allowing the, because I think, Steve, what you said is we need to set we don't have to have the zoning piece done by July 1st, do we? Do we just have to have the
time, I mean, I
Well,
think
we're
it
gonna
would be
have-
great if it was all encompassing, but the July 1st, prior to July 1st, we have to establish what that 12 and a half
right,
thousand people population is gonna.
right. So that piece can come first, and then the rest can take the time it needs to develop, right? Okay.
Okay, any additional comments? If not, all in favor of the motion, say aye.
Aye.
Opposed, same sign. Thank you, Jason. I know you put a lot of energy into your work, and you've done great with our smoking and tobacco ordinances. You do great work with our kids. I know this is going to be additional work on your plate. Include us. We'll be happy to give any support, input, or just bounce it by us, make sure we're on top of it. Rory, as always, you guys are on top of things too. And it really is good to see Matt as part of this process. So thank you.
Thank you.
I'm going to call a short break. Here.
What did we miss? Oh, the agenda additions.
Okay, no, I guess
The additions.
Yeah, the additions, yep.
oh, yes, that's you guys. Okay. Come on up, Kathy.
I appreciate the break.
Okay, Troy and Kathy,
Yeah, good morning.
we've got request approval to submit for a congressional directed funding application, substance use and detoxification facility program.
Yes, we're going to submit a request approval to submit for congressional funding for some, through Senator Klobuchar and Tina Smith's office. And we got some of the items that last year we did submit a request, mostly for the building. This year, you're not allowed to request for any building that has been completed, and by the time we do this, our building will be up and running. So we went through a bunch of items trying to figure out what could we use some funding for. So we came up with different things mostly for the clients, including some furniture for the outdoor area. We had cut the anti-ligature TV cases out of our building proposal, so we thought we'd resubmit for that. And then we're looking at Epic software for our medical records. That would work better with Sanford, since they're on the Epic system. They'd be able to improve the communication between our agencies and Sanford when we do need a medical provider. We also are looking for cell phone repeater, which would be, Rory had discussed this with us. Cell phone usage in a lot of buildings is pretty poor. So this would be one area that we could increase, that access for that. We're also looking at a new vehicle for detox, and then some various client needs that we could use this funding for, so.
So, Mr. Chair and Commissioners, there is the timeframe is Friday. It needs to be submitted in just a few days. There's also a limit on the amount we can request. It was between 1 million and 2 million at the max. So anything below 2 million, we can make a request for. So, and again, like Troy mentioned, unfortunately, can't use it for any of the building.
Any questions, comments?
One of the things that we're working on right now, but we haven't had success to this point, is the transportation piece in terms of the bus route system. And, excuse me, I got allergies here. I'm doing a lot of sniffing.
We just thought you were sad about no buses.
Yeah. But I think it's, I think it would be worthwhile for us to potentially plan, in the event that we are not successful, there still has to be a way that we can get that transportation from that facility / DMV facility to what is currently the larger bus stop at Walmart. I know it's a short trip, but, and I think we'd have to be looking at something more than a potential single passenger vehicle type of a thing. So, if we're successful, that's something that we could incorporate. And I don't know, Steve, if you have any thoughts on that, but I know one of the things that the transportation folks have told us is that, we might need to look at an alternative, do you want to chime in on that?
Sure, Mr. Chair. Commissioner Campbell, yes, we've been having ongoing conversations with the development of that area for both the DMV and the substance use facility to make sure that people can safely get there. And the challenge is currently the bus route is not reach those areas. We have had some conversations with MetroCog. I think what they call it is a micro study, as far as rather than run a bus route, is there a way to run a larger passenger van back and forth? And to Commissioner Campbell's point, this could be a stopgap because we know it's not going to be ready by the time that micro study won't be done by the time our facility's open, and so this certainly could be a stopgap to that if we had means to do that.
Any other comments? You guys got additional, Kathy?
Yes, Mr. Chair and Commissioners, we also talked about, we do provide bus passes. Okay. So we may incorporate that as well. Certainly look at, we got the vehicle from Joe, just some dimensions to a vehicle, but we may look at something larger than if we would need that and could add that in easily. And then the bus passes could maybe be an additional part of this, so we can add a few things in as we need.
Yeah.
We need to approve public health to submit for this directed funding application for substance use and detoxification facility. So do we have a motion for that?
I'll make a motion to approve.
And I'll second.
We have motion and a second. Is there further discussion?
Just one, Nick, if I may. So going to these two additions, I see you have the vehicle, but just adding on. So, I mean, is this still in line with the 500? Adding those two pieces?
We would need to add probably additional, as we come up with maybe a few things at the last minute, we may need to add additionally. Up to this point, that's approximate,
Okay,
what our
so-
costs would be.
We aren't having a number in this motion.
No.
No.
Very good.
You know, I think as you plan for a vehicle, you obviously want to make sure that you have a capacity for a few people, but at the same point in time, you don't want it so big where you end up having to have a different type of a driver's license, commercial driver's license
Right.
type of a thing to.
Well, Mr. Chair and Commissioners, I think Troy in his spare time could get his commercial license.
Or you. Seeing as how we're volunteering others.
Okay, sure, we'll get that.
Okay, have a motion and a second. Any further discussion? If not, all in favor, say aye.
Aye.
Aye. Opposed, same sign. Thanks for
Thank
your
you.
work on this.
Yeah, appreciate it.
Thank you.
Next up, we've got the current county administrator, Steve Larson.
Thank you, Mr. Chair. We're just continuing on, I guess, with the discussion of the congressional directed funding. As this board certainly is well aware, we are in the process of establishing a water district with parts of Norman and Polk County. And the congressional directed funding allows, the application allows for water projects to be something that they look at. As you're aware, 39% of the wells in Clay County during a recent study tested exceeded the maximum contaminants for arsenic, and we're working to bring that safe, reliable water to our rural residents. And so there's a request before you this morning to consider the approval of submission for this grant. I will let you know that there are grants that are also being requested through the congressional directed funding by also by Norman and Polk. The focus of the funding of this project is to get the dollars to study, design, and construct phase one of this area, and so in the northern and eastern parts of Clay County. And so the total request of this project is going to be $6.6 million. The request that is being placed before Senator Klobuchar, Senator Smith, and I think they're also going to be doing to represent our fish box office. And so the request today would be to bring forward a grant application of $5,301,798. With that, I'd yield for any questions.
Questions for Steve?
I don't have a question, but just a comment on the fact that the more I attend these water district meetings, I mean, the more important we're realizing how important it is that we're going to get this we have to get this water problem. I don't know if it's a problem yet or not, but it's going to be a problem, I think, in the future. And I think some townships have already realized, and some cities have already realized, it is a problem. We got to get going at this. And I'd make a motion to approve this.
Second with a comment. You know, as I mentioned at the small cities deal, it's, you know, this is the build out of this for good, clean water for rural areas of Clay County it's going to be a significant infrastructure investment. And it's very, you know, I kind of likened it to the issue with the broadband. And, you know, the broadband area that we're applying for that grant for, as you heard, there was about $34,500 per home to have that, you know, if there was no grant available to do it. making that just unaffordable and not, realistic to do. And, broadband and water, I think they're, in today's day and age, they're necessities. And being able to, whether your kids are living in rural areas and in school and having e-learning and all that type of stuff. So, so the investment into, being able to put in a main line for this is critical. That isn't to say that the users at some point in time won't be having to make an investment into, what they use, but to have a main line put in is critical, and this is a good step in that direction.
Any other comments? If not, all in favor of the motion, say aye.
Aye.
Opposed, same sign. Motion passes.
Thank you.
Thank you. And we will start off with the committee reports with Frank.
The only meeting I had, I went to the rural cities meeting. I just have to comment, we had good representation of county employees there, but I wish we would have a better representation of rural cities there, we had 5 of them there, and I think it's important that these rural cities get involved in what's available to them and how they can help each other and stuff. And it's a good avenue to use there is to get together and talk to each other. And I will say it was a good representation of our people, and I'm glad for their presentations. It was good to hear from the cities that were there too, of all the progress they're making and all the building that's going on. It's nice to know. Keep the taxes coming. That's all.
Thank you. Paul?
Thank you, Mr. Chair. So last Tuesday, the 16th, I had Adult Mental Health, the LAC. We had our monthly meeting. We're bringing a formalized report together for 2024 to be presented here or for 2023, I should say, for the year. And then what we see going forward in 2024. And they're scheduled to be here, I think, May 7th is my understanding, to give their report to us. Other than that was just mainly agency reports throughout, pretty normal business each month. Later that day also, I had the CAP-LP Finance Committee. We did a thorough overview of the finance. Just a couple of things that came out as we about the work that CAP-LP does. They help people that qualify with federal filings. They assisted over 800 people in their filings and in their tax preparations, I should say, and then helped them and sent out 600 federal filings, so that's a lot. Head Start is up to 158 students, 4 and 5, and early Head Start home visitations, along with early education is up to 121 students. So again, very, very big. Later, let's see, that was on Monday. Then Tuesday the 17th, I did a presentation along with several other people at the West Central Foundation, West Central Initiative Foundation, excuse me. It was in service, staff in service. They had 20 or 25 employees there. Went throughout, well, from 9 till about 3. And we had the City of Moorhead, report on development that Derek LaPointe and Christy Lebowski would give. And then I spoke on behalf of what the commission does, economic development, which I'm part of on West Central with Deb White. She spoke about that. Then we had reports from Indian Education Liaisons, Inclusive Moorhead, Jasmine Child Care Center, and parts of cultural diversity resources and multicultural partners. And along with, after that break then, Maureen Johansson with the Historical and Cultural Society gave a tour and an overview of what they do. It was a good also to hear from presentation for the Career Academy and the Morehead School District. One thing I learned in all that that I had no idea before, Morehead School District has over 50 languages spoken within their district, and that really surprised me, the diversity we have in our county. So anyway, it was it was well done, very well done, and I learned a lot during those hours with them. Later that day, we had our monthly meeting over at the Historical and Cultural Society. Went through our agency reports. Our little spotlight was on the Berquist Cabin, which many of you are maybe familiar with, and that's up by the north of the beet plant by John Berquist, and it was built in 1871. And 1868, he was a kind of the premier brick-making company in town. So, grandson of Dewey Berquist, if anybody remembers Dewey doing the weather, I certainly do. And then they received a $22,000 grant from the National Endowment of the Arts for 2 Hardanger fiddles. There you go. Next day in the morning, I was acting as your liaison to the HRA. Very good meeting. Learned a lot there quickly. It's a big operation, and anyway, we went through overviews and updates of the current properties. They're starting, and again, thank you to all involved, and the way Dara and Don are receiving grants as well on federal money mainly, and then coming down and working with the state through our social services, and then also the amount of money that the county has helped them out with. And they're definitely doing a lot of work on rehab on the buildings and other properties throughout the county. Smaller grants of up to $25,000 to keep people in their homes that may not be able to have the money to do appropriate projects on their own homes. So try to help them stay where they are. 2024 planning is coming up, and I'll have more to report on that next month. Also, I was at the Rural Cities and County meeting. Commissioner Gross already spoke to most things I was going to mention. Anyway, it was good to be there, and I too am always moved to hear our small cities are developing and growing. We heard it from Holly, Glendon, Barnesville, Sabin, Dilworth, so that was all good. That night, I had actually would have been our monthly CAP-LP meeting, which in this case, it was our annual meeting, so it was a dinner. And we did go through a shorter version of our board meeting. There was about, I'd say 150 people in attendance. So it was good. Recognitions were given to people with 5, 10, I think it was, and 25 years of service to CAP-LP. They just have some real dedicated people. And at the end of the night, they have what's called the Height Camp Leadership Award. They give it out every year to someone that has just really done some long-standing service and so committed to what CAP-LP does. And this year's recipient was a consumer. Her name is Michelle Warner. A shout out to her, to Michelle, for all the hard work she's done. She's now just finished up her term, a 9-year term on the board, and she has taken her kids through Head Start and has been part of committee work with CAP-LP for the last 20 years. So long time of volunteer service on her part. Friday, I had my Early Childhood Initiative, LAC, monthly meeting. Sanford Fit was there, that was the spotlight, giving a presentation and how Sanford works with building skills and positive behavioral patterns with young children in that early development. The group as a whole has been working feverishly getting ready for the Kids Fest, which is held at the library on May 4th, annual event. And then there went over agency reports, so that's what I want to talk about there. And then last, yesterday I had the steering committee for the Cascade Food Partners. We're developing the agenda for our May 8th Food Commission meeting and developing that, so things were brought forward regarding that, but one other event coming up, and that's next Saturday, the Yard and Garden Palooza that'll go on that Saturday from, I think, 8 until 1, I believe it is. And anyway, that's over at Shanley. And then we're taking time, we've set money aside to do a strategic plan moving forward for the food partners. We're going to be working with a consultant, Dr. Schatz, who has been used in Fargo Parks and some other areas, and kind of going over what the accomplishments have been over the last 10 years, and then how can we forward advance that in maybe new and improved ways. So that's my reports.
Thank you. Kevin?
Thank you. I had 2 meetings last week. One was the West Central Regional Juvenile Center meeting, a quarterly meeting. Went over the 2024 budget to date, reviewed the what is close to the final numbers for 2023. I think we're going to be looking at probably about a 1.4 million revenues over expenditures for 2023, which is similar to 2022. We did have James gave quite a report on what we know as DRTs, the disability room time. If you recall, there was some discussion about that at the state level, and they've come up with a system now that basically talks about how you report it. So that, they've come to realize that we were correct in needing that tool to keep everybody safe, but in the process of it, there's a really extensive amount of reporting that needs to be done. James went through that process, and it's multiple pages of things that they have to do, and the time that's involved with it is significant. We did talk about the body-worn cameras for the people within all the staff, and there was a motion made to support the purchase of, and I think one of the early estimates was $90-some thousand, $93,465, and that they were suggesting would come out of that 1.4 million in reserves. And then it would be a matter of, there would probably be an annual cost of maybe roughly $30,000 a year, and that pretty much is for the maintenance and storage of all of the required storage that would need to have of all the videos. He also gave a update to the West Central about the program that we're going to be instituting for the female population and the non-secure. We got really high remarks from all of the members, how they were basically thanking us for doing that, and And I think some of the counties are hopeful that there will be availability for them to be able to use that. And we obviously, we said it is a county first type of a thing, but if we have the availability, we'd be more than happy to allow our members to use that. That concludes my report.
Thank you. Last Thursday, I virtually attended the Clay County Suicide Substance Abuse meeting. Some general business was conducted, but we got a report from Ryan Sandvin from West Central Regional Juvenile Center. He did an outstanding job of giving the floor staff's experience in the operation through his point of view. Really gave a comprehensive summary of what's going on, the great work they're doing there, and he did it in a very professional manner, so shout out to him. Tanya Carter, a grant coordinator, talked about a messaging toolkit for Mental Health Awareness Month. Later that day, I attended the West Central Regional Juvenile Center meeting that Commissioner Campbell covered very well. And then that evening, the county city meeting, rural cities. Again, it is very gratifying to see the energy a lot of these communities are showing, the growth that's going on in them. It speaks well about the economic development in this county. We know that a lot of things are happening in Moorhead, but a lot of things are happening east of there as well. And any support we can give our rural cities is something we want to participate in. Future meetings, I agree with Frank, we need to see, to get the word out to the other cities that they can come in and participate is only going to be beneficial to them. Friday and Monday, I met virtually with County Administrator Larson, James O'Donnell from West Central, Commissioner Mojo. Friday we had Legislator Keeler on board, just discussing. We're going to go to the state capitol tomorrow and look at getting funding for the new juvenile program that we're looking for transitional housing for young women that are there in the facility. And that completes my report. Steve, what do you got for us?
Thank you, Mr. Chair. Last Tuesday and Wednesday, dealt with a couple different personnel matters with the HR department. Also, data request. I want to thank our IT department for the help on collecting that information. 18th, I met with Eric Dodds on the upcoming JPA meeting agenda that is on this Thursday. That afternoon, also, or an evening spent, was at the Rural Cities County meeting again. Appreciate everybody's attendance, also our departments for their willingness to be there and share what's happening. On the 19th, participated in the testimonial housing bill that's been discussed by Commissioner Ebinger, and that later that afternoon, also with Representative Keeler in our committee. And again, thanks to James for putting together a number of the information that they needed for both for the capital investment testimony, but also the MMB requirements. So the 22nd, yesterday met with the Sheriff Empty, and he continues to have some challenges in finding fleet vehicles, and so I appreciate the open communication there. He's hoping to have potentially some solutions with again, maybe going back to some Ford Inceptors, and then taking the chief deputies in his vehicle and put it into the fleet. Let's see, just a note, a reminder, again, that tomorrow, the grand opening of the dental expansion is there. Also on Thursday, Soil and Water is going to be having their pollinator night starting at 4 o'clock at Junkyard. And that concludes our report.
Thank you. Go ahead, Ken.
Yeah, I said I had two meetings and I didn't report on the other one. The other one was the small cities, and I think you've all covered that one well, but I did also attend that.
Okay. Brian, you got anything for us? Sarah, what do you got for us? Nada, okay. Any additional business or comments? If not, we're adjourned.